Dr. Ireland.
Hey,
Thank you for joining us today.
you're welcome.
Obviously, you're an orthopedic surgeon, but a lot of orthopedists get started or think about going into orthopedics because of something that happened to them in their earlier life. Now, you were a wonderful athlete. Can you tell me a little bit about your athletic career starting out?
Sure. Thank you for saying I was a wonderful athlete.
Well, you were.
Makes it all.
And you're in the Hall of Fame. That says enough.
Right. Thank you. So I was a kid who never wanted to come in from playing outside.
Right.
And I liked to run, jump, and I ended up becoming a swimmer. And I begged my parents to be able to let me swim year-round.
Right.
And I also did track and field hockey and basketball in high school. And when I was 15, I did have what I thought was a back injury, but it ended up being a spondylolisthesis, which literally means a forward slippage of one of the vertebral bodies on another that comes with our being erect mammals and running around and doing things. And so I ended up having to have a back fusion when I was 15, which was a pretty big whack for a young person.
Sure.
My pediatrician didn't necessarily recommend it, but I knew to be able to be active and compete or even be active enough at a level I wanted to be, I needed to have that surgery done. So I had that surgery, and my back's done pretty well. I have back pain. I'm not a marathon runner, maybe because of some back issues, but overall it was a successful surgery and allowed me to continue to swim for another 10 years competitively, and I tried out for the Olympics a couple of times.
So at age 15, and you see a fair amount of young athletes,
Mm-hmm.
and at age 15, that's got to be a big blow to your training, to what you were trying to do at that point. But you were able to come back and compete at a very high level, like you say,
Sure.
competed for to go to the Olympics. I know you were the leading scorer at Sayre High School,
Mm-hmm.
all-time basketball, so it was successful. Did that help kind of transition you into what you wanted to be as a doctor of orthopedics, or?
Well, I think it got me very interested in orthopedics because I was a motivated patient and I was going to do what it took to get back. And so I knew the doctor-patient relationship from being on the patient side. So I think that makes me be able to be a bit more empathetic and also understand what these adolescents go through. A 15-year-old, maybe not a back injury, but I see more knee injuries, ACL injuries, and that is really an important part of the athlete's life that is taken away from them. But if I can influence that by talking them through it and knowing that I can do an ACL reconstruction and give them a game plan of an ACL return to play plan, then they're back playing at 9 and 12 months. So I think I was always a good student, so I think that the injury that I had made me want to go into orthopedics.
So you mentioned ACL injuries for the lay people out there. That's the anterior cruciate ligament, correct?
Right.
And that tears.
Mm-hmm.
And what do you do as far as the surgery goes to fix that?
So the anterior cruciate ligament, or the ACL, is a ligament that stabilizes the knee and it keeps the bone from coming forward in a shifting type way. And typically it happens very quickly in a landing, cut, change direction. And what we do is diagnose it. We're better at diagnosing it early, so we do earlier intervention by MRI scans and physical exam. And then when the knee looks like it's about the same as the other knee, then we do a reconstruction. Unfortunately, we can't sew the ligament back because it tears apart like the end of cooked spaghetti strings or end of a mop. And so the procedure that we do is do an ACL reconstruction with a tendon from the person's own body in a young athlete. And typically we use a little strip of the kneecap tendon with a block of bone from the kneecap and from the tibia. Or sometimes we use another tendon like a quad tendon or hamstring tendon.
Now, I know that in the past, recovery from an ACL took a while. Has the recovery time shortened because of the techniques have gotten better, or is it still about the same?
That's a great question, and I think we've learned that faster return to play or sport after an ACL reconstruction isn't necessarily the best thing. It's returning in a safe way so you don't get re-injured. And These athletes are going back to do the same thing, the same non-contact kind of things, landing from jumping, changing directions in soccer, basketball. And so we have to get them ready both physically with getting their muscle strength back, their balance, but also fear of injury, confidence. Right. There's several things that go into the whole health package of making sure you've got a healthy athlete that's ready to go back and competing. So I think we know better how to test these athletes with functional assessments and cutting and changing directions in our rehab facilities, and then also mentally figure out, are they really wanting to go back at that same level? Are they fearful of injury? Because if they fear a new injury, they're going to injure something. So I think we've made improvements of the way we test to make sure the athlete is both physically and mentally ready to go back.
Now, I know that with ACL reconstructions, there's a fairly significant statistical variance where people will develop arthritis. So let's say that someone has developed arthritis because of an ACL injury or some other type of articular cartilage damage. What are we doing for knee arthritis now? Is there anything new coming? Is there anything that...
Sure. So one point about ACL reconstructions, we have a much better way of putting the ligament back in the anatomic place, and we can create a stable knee, but we can't create a knee that's completely like it was before it got hurt.
Right.
And so the post-ACL injured knee, it can be stable, but they can develop arthritis. And in some series, even up to 50% of people who've had an ACL reconstruction in their teens end up with arthritis 10 or 20 years later. Right. So I do think arthritis is caused by multiple different factors, including how active you are, your parents, your genetics, sure, and also your weight and fitness. So for osteoarthritis, I think it's important to make a diagnosis. So if you've had an ACL reconstruction, if you have any knee pain, it's probably good to get follow-up x-rays yearly or every 5 years, right, just to see where you are. Unfortunately, we don't have any wonder injection that reduces progression of the arthritis or that makes arthritis go away. I think we'll have that in the future, and that's something that you want to keep up with your healthcare provider, just to ask them questions. The present treatments with injections for knee osteoarthritis are not changing the progression of the arthritis. There's several different ones. The steroid medication makes you feel better, but then you might go out and do too much and injure your knee worse because, right, you can't feel it. So you don't want to get too many injections. Now, older people who have arthritis that's kind of severe arthritis, and maybe they can't have total joint replacements, we do injections with steroids. And we see a lot more things come out on the market, so to speak, with injections with different things like PRP or stem cells, which are meant to improve function by reducing knee swelling and increasing maybe range of motion and reducing pain. But the long-term studies don't really show that it's going to reduce progression of arthritis. So that's where I think it's important to, get followed up.
Yeah, but knee replacements are far more common now,
sure,
with youngish type people.
Right. We like to get people in their late 40s, 50s, but knee replacement surgery is very successful, and you want to do it at a time when you're noticing your maybe you're not exercising as much, you're gaining weight, you're developing hypertension because you can't exercise, right, as much, and so you want to really be followed and make sure that you and your surgeon make a good decision on when to have that knee replacement surgery, and also to know what's in the rehab afterward and what activities you'll be able to do. You probably shouldn't go back and play basketball or play, right, higher level sports that might put more wear. It's not like having a completely knee joint like we come to this earth with. It's right, it's a replacement, but they last usually as long as you're going to live if you take care of it.
I know that techniques and materials that are used are probably improving all the time. So I would assume that with knee replacements, hip replacements, things like that, that the techniques are improving, then the materials are improving. So people shouldn't be too discouraged if they have knee arthritis that looks like maybe they're going to have a replacement, because the replacement tends to give them a fairly high quality of life. Is that correct?
That's correct. And sometimes people wait too long. They might have other
That's a
disease
great
processes,
point.
and if they do that, then they can't have a knee replacement or hip replacement. And probably the hip replacement is an easier thing to get over because you don't have to work as much with physical therapy and getting the range of
Right.
motion back. But as kind of shocking as it might sound to somebody that needs a knee or a hip replacement, it really is a great procedure. You need to go to somebody that does a lot of them, go to a facility where they have very few infections, and pick your surgeon and make sure you have a good relationship with that surgeon and know what's going to happen. And don't necessarily talk to all your friends. Some of them may have had good and bad experiences, so I think you need to have that relationship of the adult reconstruction team to get you
Right.
ready for your knee replacement. And you're the one driving the replacement train, so to speak, so you're not going to get pushed into it. You need to understand what's going on.
Are there differences between males and females on incidents of knee injuries, on outcomes of knee injuries?
With ACLs or
Well, just
osteoarthritis?
I would say ACLs would
Right.
be the one I
So
would be.
with ACL injuries, particularly in teenagers, active teenagers, girls are 3.5 more times greater incidence of ACL injuries than boys in basketball, and 2.5 greater incidence in soccer.
Wow.
So we have
That's significant.
tried to do. I've spent most of my career trying to prevent these injuries from happening. For better or for worse, I'm not out of business. But girls are more active, jumping, changing direction. So there still are some factors, and I believe it's a lot to do with landing patterns and hip and core and balance and proximal control that girls don't quite have like the boys have.
Well, you are a champion for women and women's sports, and I know that you have started a new foundation to kind of help facilitate young girls and girls in general to become active. It's called the Active Women's Health Initiative.
Yes.
Do you want to talk just a little bit about what that is?
Sure. Well, I know how much being active meant for me and my ability to be educated, become a doctor, become a leader, become a successful orthopedic surgeon in a male-dominated profession. So what I feel is that, particularly in Kentucky, we're getting more obese, less active, and women and girls drive the healthcare train. So if we can get girls to motivate their parents and to eat better, be more active, we're hoping to optimize wellness throughout their lifespan. And this initiative is the Active Women's Health Initiative, and I'm really fired up about helping support that. And I did do some initial donations, but we're getting great support from donors who are interested in what we're doing and our board, including you, the president of our board. And so the Active Women's Health Initiative now is entering its second year. We have a great director, Dee, and my co-director, Hannah, and we're working as a really neat team within the College of Health Sciences. And our new program is called Girls Can. That is from kindergarten through 8th grade, and we're enrolling children, girls, to do certain events. We just had a soccer event, and we're going to have a basketball event where you have an activity, go to a ball game, University of Kentucky women's ball game, and we'll continue that program and hopefully do some events in the spring, like maybe track and field or maybe swimming.
Right. So I know sometimes people who see these, they say, well, what can I do to help, or what are some of the things that make sense? And one of those is to support this initiative.
Yes.
So if anybody out there is interested in finding out more, we'll include the link to the Active Women's Health Initiative in the description. And if they want to click on that, they can find out more about that and ways to actually
and
donate
supporting
to it.
programs like Girls Can. We want to have lectureships and have have role models for these girls, have mentors so that they can ask certain questions, whether it's a career or maybe what athletics they want to do. Or we're also trying to get the less active girls out there to do things because you got to move, you got to exercise.
Right. Well, I know that with what you've done in your life and in your career, you set the bar as kind of the gold standard. So we hope that a lot of parents see their child and children and direct them in a sort of like how you've taken your life. And We just really appreciate everything that you've done for the community here. I know you've treated lots and lots of people and gotten them back to activity or to their sport so that they can continue a quality of life. So for all of us that have been under your care, we appreciate you.
Well, thank you.
And thank you so much for taking the time to talk with us tonight.
You're very welcome. I feel very blessed to have the opportunity to take care of so many great Kentuckians, and I learn more from you than vice versa.